I found out I had Parkinson's disease 6 years ago. I'd been feeling some stiffness in my legs and a slight tremor in my hands for some time, and my wife insisted that I see a doctor. I thought it was nothing, but my doctor wasn't so sure, and he referred me to a neurologist. When I was finally diagnosed with Parkinson's, I couldn't believe it. I mean, I'd been healthy all my life, and I felt fine, apart from the symptoms I've just mentioned. I was still going to work at the office every day, golfing every other weekend. So the idea of a serious disease like Parkinson's disease just floored me. I didn't want to believe it. I was mad. I guess looking back at it, I was in denial. Still, sometimes I still find it hard to accept the fact that I have Parkinson's disease.
The early symptoms of Parkinson's disease are barely noticeable, and it is often a spouse or a close friend who is the first to notice a subtle change taking place. In the early stages of your Parkinson's, it may be that you just felt tired and thought you needed a holiday. Shaky hands? Well, that's simply too much coffee. And stiff aching muscles? Probably nothing more than overdoing it at the gym. Such is the benign nature that characterizes the onset of Parkinson's disease. There are, however, some common symptoms that you may have experienced. Tremor, arrhythmic movement or shaking, particularly in the hands. Slowness when walking or doing simple activities like washing or getting dressed. Muscles that ache or become very tense and stiff. These are just a few of the many different symptoms of Parkinson's disease. Whatever your symptoms, they will be very different from the symptoms of someone else. In fact, every person's experience with Parkinson's is unique.
I never had any of the shaking of the hands or head that a lot of people associate Parkinson's disease with. So far, my symptoms have been mild, affecting my legs. They ache and are weak. The worst it's ever been were stiffness, so stiff that I could hardly walk. Still, I consider myself one of the lucky ones. There are a lot of people out there with Parkinson's disease with symptoms far worse than mine.
Sitting here with me is Dr. Anne-Louise Lafontaine, a neurologist at the Montreal General Hospital. Dr. Lafontaine, I know very little about Parkinson's disease. However, having done a little of my own research, I do know that it's thought to be due to a lack of dopamine in the brain.
Yes, that's correct. Dopamine is a chemical that's naturally produced by cells in our body. It carries signals between nerves in the brain to control body movements. When the cells that produce dopamine are damaged, the body doesn't get enough of the dopamine it needs, and that's when Parkinson's symptoms develop. Unfortunately, we don't know why this happens, and we can't stop the disease process, but we can manage it using a variety of means. Physical and occupational therapies are an example. Diet and exercise can help. And, of course, we can treat the symptoms with medications.
Such as Stalevo?
Yes. Levodopa is a drug used to treat Parkinson's disease. Stalevo is used to treat people in whom the effect of each levodopa dose becomes shorter and who then experience fluctuations in the symptoms of their disease, something called end-of-dose wearing off.
How does it work?
Stalevo contains 3 substances in each tablet. One is levodopa, which is given to increase the levels of dopamine in the brain. However, when levodopa is ingested, the body breaks it down in much the same way as it does with food. Consequently, only part of every dose is able to reach the brain. The other 2 substances in Stalevo, carbidopa and entacapone, help to prevent this breakdown so that more levodopa reaches the brain.
And this can help improve the symptoms of Parkinson's disease?
Yes. Stalevo helps in relieving symptoms such as shaking of the limbs and stiffness and slowness of movement.
Are there any precautions that people taking Stalevo should know about?
Yes, some people feel sleepy, drowsy, or rarely may suddenly fall asleep without warning when taking Stalevo. While this may not sound serious, it can be very serious if it happens when you're driving a car or operating a piece of machinery. So if you take Stalevo, you should take special care when you drive or operate a machine. And if you do feel very drowsy or have a sudden onset of sleep, avoid driving and operating machines and report it to your doctor.
What kinds of side effects could a person taking Stalevo experience?
The most common side effects are uncontrolled movements, nausea or vomiting, loss of appetite, abdominal pain, dry mouth, constipation, diarrhea, weight loss, mental changes including paranoid and psychotic symptoms, feeling agitated, depression, possibly with thoughts of suicide, and problems with memory or thinking, hallucinations, confusion, itching and rash, and a reddish-brown discoloration of the urine. If you experience any of these side effects, talk to your doctor as soon as you can. Many of them can be relieved by adjusting your Stalevo dose. Also, contact your doctor if you experience a decrease in blood pressure when standing up rapidly after sitting or lying down, whether or not you have other symptoms such as dizziness, nausea, fainting, or sweating. Tell your doctor as well if you experience any of the following uncommon symptoms: an irregular heartbeat, chest pain, shortness of breath, symptoms of a bleeding gut or ulcer, such as abdominal pain, nausea, vomiting blood, or blood in your stools, infections, bleeding, or convulsions. Very rare side effects that should be reported to your doctor include severe diarrhea with significant weight loss, excessive sleepiness, drowsiness, or suddenly falling asleep, symptoms of hepatitis, such as yellow skin and eyes, nausea, loss of appetite, or light-colored urine, or serious skin reactions such as a rash, red skin, skin peeling, or blistering of the lips, eyes, or mouth. Stop taking Stalevo and tell your doctor if you experience very rare side effects such as increased muscle rigidity, muscle twitching, increased tremors, agitation, confusion, altered consciousness, fever, a rapid pulse, or wide fluctuations in blood pressure. People taking Stalevo should also be aware that entacapone enhances the effectiveness and effects of levodopa. If you weren't previously taking entacapone tablets with your levodopa, carbidopa tablets, switching to Stalevo may cause an increase in certain side effects of levodopa, such as uncontrolled movements, feeling sick, throwing up, or hallucinations.
Is there anything else we should know?
There's one thing that all patients with Parkinson's should be aware of. Some people who have Parkinson's disease may be at increased risk of developing melanoma, a form of skin cancer. Although we don't know why, it could be due to the disease itself or the medications used to treat it. It's always a good idea to check your skin regularly and have it examined periodically by a doctor.
That's good advice for all of us to follow. Now, Stalevo isn't for everyone. Who shouldn't take it?
Obviously, you shouldn't take Stalevo if you've ever had an allergic reaction to levodopa, carbidopa, entacapone, or any of its other ingredients. Also, you shouldn't take Stalevo if you're currently taking certain MAO inhibitors used in the treatment of depression, either both MAO and MAO-B inhibitors simultaneously, or non-selective MAO inhibitors, or if you've been told that you shouldn't take sympathomimetic drugs such as isoproterenol, amphetamines, epinephrine, or cough and cold medications containing drugs related to epinephrine. You also shouldn't take it if you have liver impairment, narrow-angle glaucoma, a kind of adrenal gland tumor called a pheochromocytoma, a history of a rare form of muscle disorder called non-traumatic rhabdomyolysis, a history of neuroleptic malignant syndrome, which is a rare reaction to medicines used to treat severe mental disorders, or any untreated disease of the heart, lungs, kidneys, blood, or hormones.
Untreated?
Yes, there are always some people who may not even know they have a health problem that needs to be treated. High blood pressure is a good example of this because most of the time there are no symptoms. That's why it's important to always check with your doctor before starting any medication, including Stalevo, to make sure it's suitable for you.
You mentioned drug interactions.
We need to be careful when some medications are combined with others. Stalevo, for example, can increase the effect of some medications, and conversely, some medications can decrease the effect of Stalevo.
Can you be more specific about that?
Well, Stalevo may increase the effects of certain antidepressants and medicines used to treat high blood pressure. Medications that can lessen the therapeutic effect of Stalevo include those used to treat mental disorders, reduce nausea and vomiting, prevent convulsions, and relax muscles. Even simple iron supplements can make Stalevo less effective. This doesn't necessarily mean you can't take any of these types of medications with Stalevo, but you may need to have your dosages adjusted or have frequent follow-ups with your doctor. For this reason, it's important to tell your doctor about all medications you are taking or have taken recently, including non-prescription medicines and herbal products.
I guess you could say the treatment of Parkinson's disease, or any disease for that matter, means building a strong relationship with your doctor. It's really a two-way partnership, isn't it?
Very much so.
I'm a very self-sufficient person, very independent. But whenever I have a question, I always ask my doctor because I can trust her completely. Usually it's as a result of something I've seen on the internet. Now, I use the computer a lot, and there's a whole world of information out there. My wife is very supportive, and she forces me to go out with her, and I'm grateful for that. And both she and my doctor are trying to do their very best to help me. They want me to keep a diary of my on times and off times. Well, so far I haven't. I'm a bit of a procrastinator. I'm just too busy. In my own mind, I have a good idea as to my on times and off times without needing to keep track of it. Still, I realize it might give my doctor a good idea as to how well my symptoms are controlled. I haven't yet, but, well, maybe I will someday.
Dr. Lafontaine, we've talked at length about the importance of symptom control and how Stalevo can help improve it. If someone is going to start taking Stalevo, what do they need to know about dosing?
First of all, Stalevo is available in tablet form, and only one tablet should be taken at each dosing. The tablet should be swallowed whole, not split or broken, and you can take it with or without food. Taking Stalevo with a biscuit or other light snack may help lessen the possibility of having gastrointestinal side effects.
How often should Stalevo be taken?
That will be determined by your doctor. Your doctor will tell you exactly how many tablets to take each day and when to take them. Your dose may be increased or decreased depending on your response to treatment or if you experience any unwanted effects. You should never take more than 8 tablets of Stalevo in any one day. The most important thing any patient can do is follow their doctor's instructions and never stop taking Stalevo without consulting your doctor first.
Is there anything more that you'd like to add?
Always bear in mind, Stalevo has been prescribed for your use only, so keep it safely stored in a cabinet, well away from the reach of children. It should be kept at room temperature. And never take your Stalevo if it's past its expiry date or if the package shows any signs of damage or tampering.
Dr. Lafontaine, you've been very helpful. Thank you.
Sure, you have your good days and your bad days. Whenever I'm having a bad day, I have to cancel my plans. I still work full-time. And funnily, work motivates me. I'm good at work. It's the weekends that are a little more challenging. Perhaps because they're less demanding, less structured. So I work on my brain. I do memory games, sudokus, crossword puzzles, brain teasers, that kind of thing. I like to stay active too. Although I don't golf anymore, I like to work out, to exercise, to keep fit. I do weights and boxing, but I can only do that on my on times. If I try on my off times, I just get exhausted. So I have to learn how to pace myself. On the whole, I still find it hard to believe that I have Parkinson's, but I'm fighting back. I'm not a quitter. Never have been, and never will be.